My biggest concern was not that I might die of this disease, but how I was going to live with it for as long as I could have. Hi, my name is Terry Woodhull. I'm 54 years old and a 6.5-year survivor of advanced ovarian cancer. My mom died of breast cancer in 1990 at the age of 46. Her mother had breast cancer, her mother's mother had breast cancer, and my mother's first cousin had breast cancer in her 40s. So even when she died back in 1990, the doctors told us that they didn't quite understand it yet, but they were sure there was some sort of hereditary aspect to this disease. Unfortunately, what we didn't realize as the science was evolving was that it also meant that I probably would have extraordinarily high risk of other cancers, namely ovarian cancer. There are no early detection tests, and the symptoms, if there are any, are so vague that it is very often undiagnosed until a late stage. I was diagnosed with advanced ovarian cancer at the age of 47. I was tested and realized that I indeed did inherit the BRCA mutation from my mother. Once I was diagnosed, we immediately had a consultation with a gynecologic oncologist. She recommended that I consider a clinical trial. As a part of my follow-up from that clinical trial, in the fall of 2014, despite feeling terrific and having gotten back to my life and everything was great, the disease reared its ugly head again. And so in that CT, there was evidence of new tumor growth. So I started on a journey of trying to get myself into one of these trials for a targeted treatment, because I figured it offered me the best opportunity for, again, a quality of life for as long as I could. Had a wonderful consult with Dr. Joyce Liu. She was aware of a small sub-study, a QT sub-study for a drug called niraparib. And because it was a sub-study, I knew it was open label. I knew I would get the drug. There was no chance I would be getting a placebo. It was in San Francisco. So I sent my records out to San Francisco, got a call from the research coordinator on a Tuesday night. Unfortunately, we only have 2 spots left, and someone is coming tomorrow morning at 9 for the 1 spot. So if you think you want the other spot, you have to be here at 2 o'clock. I said, I'll be there. I booked a one-way ticket, called my husband, packed my bag, flew out to San Francisco, showed up the next morning in his office, had a whole day of exams, blood work, etc. Got a call on Friday and they said, yep, it appears you do qualify. You need to come back on Monday for a final confirmation CT. Went back on Monday, had the CT, waited Tuesday, and Wednesday morning at 8 o'clock, I started the trial. That night, I took the red eye home, flew to my daughter's graduation from nurse practitioner school at Duke. It was pretty crazy. But here I sit, 27 months later, and I'm stable. So the wondrous thing about this drug is it's not a cure. I still have disease, but the lesions that I had or the masses that I have actually shrunk a little bit, and they've not grown, and I have no new disease. So it's allowed me to maintain. And for a woman with recurrent ovarian cancer, stable is about as good as you get. In my mind, it's given me time, because as science advances and the other drugs and the immunotherapy drugs and some of these things that we think might actually hold the cure to cancer are out there, I might have an opportunity to be a part of that as well. So every day, every month, every visit I have where my scans stay stable, remind me of how fortunate I am that I'm in this position. Obviously, from a very personal standpoint, I think funding research, and cancer research in particular, is really important. I've benefited personally. My family's benefited because I'm still here today and able to live with my disease. But more importantly, we need to be investing in research for our future. My daughter inherited the BRCA mutation from me. I have cousins that inherited the mutation. I want them to not have to face the same experience that I did. And if we don't invest in research, we're not going to stop that progression.